There we go. Well, I think we're going live here, guys. Good evening, everyone. I'm going to take a quick look, make sure all our setups are correct, and we will officially start in about 30 seconds or so. I know we have about a few of the attendees here already, and we are all set up. Can you guys hear me, Winston, Ofer? The volume is good here?
Can, yeah, you bet.
That's good. Welcome, everyone, and thank you for being with us here tonight. This is going to be an exciting webinar, of course. It's going to be more of a kind of a chat between the three of us here. This is going to be a little bit different. But before I go any further, for those of you who don't know me, my name is Dr. Shouresh Charkhandeh. I am the head of faculty and a strategic advisor here at Zephyr Sleep Technologies. And tonight I'll be the host and the moderator for this conversation, I like to call it, as opposed to a webinar. Tonight's webinar is going to be a little bit different. That's what we usually do. I'm going to be talking to a couple of great guys, great clinicians that I've had the pleasure of getting to know over the past few years and past few months. We're going to be talking about their journey into sleep and how they got to where they are today. Both of them I respect dearly, and I truly admire what they've done in their clinics and who they are as clinicians outside the world of sleep. So that's what I'm very, very excited about, to be having you, both of you, online with us tonight. Thank you both, Ofer and Winston. We'll get to the official introductions as well. One of the reasons I really like this model is the fact that despite the fact that we have all our own journeys and our own different way of getting to our goals, the challenges happens to be the same. Doesn't matter where you are in the world. I've learned that from my experience and the privilege of that, what I had to talk to a lot of people from different parts of the world. And we learn from our mistakes. That's what we do as humans. That's how we improve. That's how we get better. But at the same time, it's that whole notion of we don't live long enough to make all the mistakes ourselves. So it's always good to kind of learn and listen to people that they've done it in a great way, and see what we can learn from that. What was their challenges? What are the things that they ran into, and how did they overcome, or what are the things that worked really well for them? So that's what I'm very excited to talk about tonight, having you both online with us. Before we get into the details of tonight's webinar, I do want to go over a couple of housekeeping rules here. The webinar tonight is going to be recorded, and it will be available on Zephyr's YouTube channel within 24 hours or so. If it's not, make sure you contact the team at Zephyr, and they will be able to help you with that. Also, we are going to have a Q&A session at the end. We're going to set aside about 10 to 15 minutes for any questions that you will have for Dr. Doron and Dr. Wing as well. And of course, myself, I'll be more than happy to answer any questions that will come up. We will also have Oren from Zephyr, who is the head of our customer success team. And he will be here for the attendees that already have a MATRx unit and they may have some technical questions. So Oren is with us as well. He will join us at the Q&A session as well. So if you have any specific questions for him, feel free to use the chat box. If you look at the right side, there it says go to webinar control panel. There is a little chat box there. Please put all your questions there, and we will make sure we get to as many questions as possible. If we don't get to all of them, of course, we'll make sure either myself or Dr. Doron or Dr. Wing or somebody from Zephyr will get back to you specifically. If you have any personal questions for Dr. Doron or Dr. Wing, they can choose to whether answer it or not. Do not ask Dr. Wing's age, because he will not share that with you. He never ages, and we will not get into that, of course. But that being said, I do have the absolute pleasure of introducing both of you. Truly thank you for being on this conversation and this podcast, this webinar with me. I've known you for a few years, Winston, of course. You're just a great gentleman, great clinician, amazing dentist. I told you your patients are lucky to have you as your clinicians. I'm going to get you to introduce yourself on your own words, but I just want to make sure everybody knows that. And Ofer, we've had the pleasure of meeting each other a few months ago, pretty much online at the Smart Care course. And within the first few sessions, I just knew the level of dentistry and the level of care that you provide. The questions and the points that you would bring up in the conversations showed the level of care that you have for all your patients. So it is truly an honor to have you both on here with us. Cannot wait to hear about your journey and what you have to share with the guys here. It's very interesting. I was thinking about this today. These two guys don't have much in common. As a matter of fact, they are almost, I think, 5,000 kilometers from each other. We got Dr. Wing from River, small rural town in Alberta. And we got, of course, Dr. Doron in Farmington, Connecticut, correct? Different journeys, different path in dentistry, but the one thing they have in common is their care and their passion for providing best for their patient. And it's going to be very interesting to see how each one of you has accomplished that and how you got it to where it is. Also, you do have one more thing, I think, in common. I think you both have the snow in your forecast for Friday.
Yes.
I checked that already. So that's the other thing you have in common, Connecticut, Peace River. Aside from that, let's just go to that. Why don't I start with Winston, if that's okay. Dr. Wing, tell us a little bit about yourself. Tell us to the people that are online with us. Tell us about your journey. How long have you been doing dentistry, and perhaps how you got into sleep briefly.
Okay, well, let's start off with my age. I'm 12. That's what I've been told. So that's at least that's what my spouse tells me. I'm always a kid at heart. I think that's part of being alive, is just being young at heart, especially in this day and age. I've been working. This is my 30th year. Graduated in 1990 from the University of Alberta. Practiced in Alberta, Canada. Have a clinic here. Fantastic team that works with me. I enjoy doing all aspects of dentistry. I do a lot of different types of dentistry. I do a lot of implants. I love root canals. I love surgeries. I have a CEREC machine here, so we do a lot of CEREC dentistry as well. I own a day spa with my lovely spouse, Wendy, so I do a lot of Botox, Dysport, neuromodulators, dermal fillers as well. So I tend to play with a lot of stuff. But my latest passion play for sure is the dental sleep medicine. And I'd mentioned this earlier to Shouresh, and as we kind of logged in, this dental sleep medicine is very important for me. It's actually very integral for everything that I look at every day now. Today was all day was an airway, breathing, sleeping day. I started with patients looking at everything. His favorite line, which I use almost every day as well. The eyes don't see what the mind doesn't know. I see a lot and I know a lot. Maybe I know too much now. Maybe that's too. But everything I have and everything that I do is focused on treating my patients and treating them well. That's why they come to see me. When they come to the Wing Dental Center, they're there for me to take care of them under my care. So I've training through Shouresh, Dr. Charkhandeh has helped me to treat my patients way better. Thanks, Shouresh, for having me as one of your disciples.
Thank you, my friend. It's a pleasure. Again, what I would define you as, you're like a lifelong learner. That's how I describe Winston. And we are all friends around here, so Winston, Shouresh is fine. Let's just get it informal and go from there. But what I admire you about,
can I just call you Sensei? I always call you Sensei.
There we go. What I truly admire about you is, again, it's just always learning, always learning and changing the best.
Right.
I want to come back. I want to hear a little bit more about what you mentioned about the wellness center. But before I do that, I do want to get Ofer into this conversation as well, so people kind of get to know a little bit about your background, Ofer, and then let's keep this more of a piece of conversation around a round table, the three of us.
Right. So I attended UConn for dental school, graduated in '98. I attended the AGD residency, and after residency, I was kind of actually stayed in the residency working as the assistant program director while I was kind of venturing out into practice. I was doing that for several years, and in '06, I was asked to come back in and actually lead the residency and be the program director. I always loved teaching, and it was kind of part of what I wanted to do, and it was an opportunity I couldn't pass. So I figured it's time to try and see if this is really what I'm all about. So I joined the faculty and ran the residency, but my fingers were itching for clinical stuff. I guess that's what I went to dental school for. So in '09, I had the opportunity to join this group practice where I'm at right now, and I took that. As far as my introduction to sleep, I was on a webinar yesterday, and I was listening to Mark Murphy, and he described himself as a cowboy back in the day when he started doing sleep. And I want to say that I was one of those cowboys. Patient come in, they're snoring. Can you fabricate something? Sure. You take a bite registration, a protrusive bite. You go on this website, that website. You figure out you think you figure out how to do it. And that's what I was doing. And then it was 2016 when my wife was nudging me almost every night, to stop snoring, and
Wow.
I was kind of in denial, kind of wearing this snoring as a badge of honor, like I work hard, it's like I'm tired, it's okay, it's just a snore, and she was again persistent, and I said, just schedule me an appointment, I'll go, and I did, and diagnosed with apnea myself.
Wow.
And the sleep physician says, you're a dentist, fabricate an appliance. And that's when the light bulb turned. And I'm like, all those patients that I've been giving appliances to, what about them? And that's where I kind of questioned, what am I doing really? And that's where I started looking into this and see what do I need to do? And I found myself, kind of into the ABDSM. I attended annual meetings, started taking courses, and then when mastery program opened, it was kind of a no-brainer. I mean, I needed someone to guide me in doing it the right way, and that's what I did. I did the mastery course, took the board exam, and became a diplomate thereafter.
Nice.
So that's kind of how I got into sleep, and that's what I do now. I still do general dentistry in my practice. It's a big portion of what I do. I want to say sleep is between 5 to 10% at this point.
Yeah.
Would I see myself eventually going 100%? Yes. I still love doing dentistry and using my hands different ways. So combining the two right now works for me. But yeah, that's where I'm at right now.
Yeah, no, I like that story because, as you said, quote unquote, the cowboy style. That's a lot of us who started earlier on in this field, right? You just went in there, and it was still with the right intention of helping patients. It's just we didn't know what we didn't
Correct.
know, right? And
Right.
now we learned a lot in the past 15 years, even past 5 years alone. And that's a very common theme there. The key is always trying to improve the best, right? And that's what we always discuss here, the common theme right here. But anyway, I want to go back to Winston here. Winston, tell me a little bit about your general dentistry journey. You said you graduated in 1990, so this is your 30th
Correct.
year,
30th year.
which
Slugging away.
honestly, I have a hard time believing this. I don't know what you
Yeah.
think there, Ofer. I feel like he might be pulling our legs here a little
That-
bit.
I think so.
Yeah.
Tell, on, telling the truth. Yep. Yes,
So,
my general dentistry.
like, how did you get where you are? Because I know in your clinic, just for, again, I know you mentioned it briefly, but I do want to make sure everybody understand. You do very, very complex cases in your clinic. You
Yeah,
practice in a tiny little small town
I do.
in Alberta, where anybody else that would have been there, I don't want to generalize this, but a lot of people would have thought, hey, well, I'm in a tiny little place, there is no need for this kind of high technology or this level of dentistry. If people want that, they can go into a city and get this done. And I've heard that a lot from a lot of graduates, from a lot of
Right.
dentists. But what even prompted you to kind of get into this kind of high level of dentistry? I know you do a lot of full mouth rehabs. I know you do a lot of smile,
Right.
everything almost. Anything that you guys can think of, this guy has taken the course and is almost a master on it. But what
Well,
was the driving factor behind that?
Well, again, very kind words there, Shouresh. But I think as you said it earlier too, I am a student of learning. I've always found that passion. I've always wanted to learn more. The biggest drive for me is, of course, taking care of my patients first and foremost. So it's kind of a unique situation. You said it well. I'm in a smaller center here, and people, they didn't want to tend to drive as far to get some of this treatment. And the analogy that I always say is like, in our town, I go, people in our town, we have teeth just like someone in LA would have teeth, someone in Toronto, someone in LA, as I mentioned, or Calgary or Edmonton. And in our small town, we have teeth, we have gums, and we have airway. So for me now, I really wanted to make sure that I could help treat the people well. Now, my journey, you're right, I do a lot of dentistry, and it started off by doing a lot of learning on different aspects. I do a lot of TMD. I do a lot of craniofacial pain management, because again, the people didn't want to really drive to get the stuff done. So I kind of took it on myself to really learn it and want to learn it well. So my humble beginnings, I did train, do a lot of neuromuscular dentistry, and do a lot of cosmetic dentistry as well. But the area that I really found important was, here's the bit of the story that kind of drove me into the dental sleep medicine part. I started to treat a lot of patients, and I could treat them very successfully using the neuromuscular techniques. And a lot of the people I could fix. I could treat them and they would feel a lot better. They'd feel fantastic. But there were some patients that I just couldn't nail down doing some of the techniques that I was performing, such as the neuromuscular orthotics. So there's some people that I just couldn't dial in and couldn't dial down them to feel better. And I think at that point, again, most people I could make them feel better, but there's some that just I couldn't resolve with a neuromuscular orthotic. So then enter a chance meeting with you, Shouresh. It was at that point that I actually had a patient that I just didn't seem to be able to resolve. And then I met you, took your course, and realized that dental sleep medicine was a big part of how to treat people. There was a missing part of my treatment toolbox to help my patients to feel better. Mm-hmm. So again, that was the journey to kind of, I want to help my patients first and foremost. I got to treat them. That's number one. Number two, again, that helps satisfy my need to learn more and do more to treat people way better. So yeah, we're in a small town. I kind of say it this way. I go out and learn a lot of dentistry. I've traveled the planet, traveling to Europe, traveling to the United States, learning from who I felt were the best of the best. And then my statement is, I want to do world-class dentistry in small town Alberta. So that was my drive to treat the people that I treat.
Amazing.
And I truly admire that. And I was hoping you say that, because I remember you mentioning that before. And you do provide truly world-class dentistry in a small town. And
that's right.
I almost feel like, before getting into details, because I do have a question for Ofer with your TMD background on the same kind of a topic of TMD and airway. Mm-hmm. But it almost sounds like it is your drive to provide the best, not necessarily just for the patient, but for your own satisfaction and for your own career path, which is something that as dentists, we take it lightly. For some of the younger guys that might be online with us, I find that to be extremely, extremely important. In today's society, in today's world, I feel like dentistry is being pushed. The success is just being measured always by financial success,
right?
As opposed to actually what it is that is rewarding and what it is that you would love to do. And what you mentioned really, really kind of reinforced that. You're doing the best because you believe people deserve the best. And if there is a better way of doing things, you want to do it that way. Of course, as a result of that, your patients are getting great treatment and you're making really good financial decisions. And I'm sure you're a very successful guy in your business as well. But the key goal for you has always been to do the best, because it makes your career feel fulfilling. And
Correct.
30 years later, you still have that drive to get out of that small town and fly, as you said, all around the world to learn from the best. Where a lot of people at 30 years out of their clinic, they could be ready to retire almost.
Correct. Yep.
So there is a very important message for those of you who are just joining us or younger, as I said, to do what you believe is what's going to make you happy. So if you look back 15 years from now, you can say, well, you know what? I am happy that I did that, and my best has changed over time, and
Correct.
feel good about it. Otherwise, the industry can be very challenging. And
That's
I don't know
right.
what your thoughts are on that, Ofer, but I do want to kind of turn around on what you mentioned about TMD and airway, because that comes up all the time. And I know you're quite an expert on that side, on both subjects there, Ofer. You treat a lot of TMD, and you said you're kind of familiar with that. I know in your practice, you still do all aspects of dentistry. What's been your experience on that? Like, how did the sleep fit in that side of your practice?
That's a good question. Again, what you see a lot of, there's a lot of correlation between bruxing and TMD with sleep apnea. So, taking a look at all these patients that we fabricate the night guards for, and doing the exams and taking a look at, what is the real cause for this? Is this just clenching or grinding, or is there something behind that? Is that kind of a tip of the iceberg? So you take a look at things differently. And then when you start doing that, you realize that, what's going on there is something totally different. So that's how again, but like you said before, it's all with education. It takes time. It's like in the beginning, you don't see these things. And you might think you know, but you don't really know. So again, taking
So
courses.
give me an example. You know what? I'm gonna kind of go there. Like, is there a patient or is there a case that you would specifically, for instance, remember that you were like, oh, hey, I've been trying to get this patient stabilized, and then all of a sudden the aha moment came for you, I guess, because I know you mentioned you come from that academic background. You want it. You're the research guy. How did that all come together for you, I guess?
In terms of sleep.
In terms of sleep, yeah.
It's hard for me to say. Again, it takes time for things to kind of mold and come together. It's a process. It doesn't happen overnight. So again, wasn't really an aha moment for me with a patient. It takes time for, again, you to realize what is it you're doing, and pushing patients in the right directions. And then it's when they come back to you to say that thank you for helping me. That's the reward in all this thing. That's my experience been.
Yeah, and I fully agree. And you said it really well. It's a process, basically. It's a journey. It's a journey that it starts, and as you go along, you hope that you're kind of in the right direction as you're moving forward. And when you kind of get to that destination, which you think you're there, then you just kind of realize, wow, I didn't even realize where I was going with that. But can you take a few minutes, let us know about how that, like you kind of pointed out on that, about you started with kind of making the snoring devices, and then you kind of got into it yourself because you had a sleep apnea. Then you realize, well, there is more to it than just a snoring. And your moment, for me, I feel like your aha moment was, well, I was like, well, if I deserve a sleep test and I need to know what my problem is, why didn't I do the same for my patients?
Correct.
And from there, you decided to take your journey of learning with some evidence-based accredited, such as American Academy of Dental Sleep Medicine, taking courses until where you are. But do you mind sharing a little bit about what was your challenges throughout that journey? What was it that you would think that if somebody is just getting into sleep today may experience going through the same journey? Because it's not going to be unique, right?
I think the most important is you have to find a mentor. And again, and I think the academy was great. It gave me a lot. And I told you, like, I was in February, I was in Orlando attending one of the ABDSM's meeting, And you kind of go through the booths and take a look at things. And I ran into Amy from Prosomnus, and we got to talk. And she introduced me to the MATRx, and I had questions. And she said, "You have to meet Shouresh." And I'm like, "Who is Shouresh?
Who is this guy?
Who is
Right?
this guy?" And I'm like,
Start.
"Okay." And that business card went in my bag, and then COVID hit, and I was looking through stuff and saw your name, and I researched and got to, I think, talk to you via email, and I questions like, I just finished the mastery course and I did all this thing. What is this, smart care going to give me? And you said, be patient. Because I wanted to jump through the hoops and get to the end. I wanted I want to get there. And you said, slow down. And I did, and I think, again, the way you do it, and that when I'm talking about a mentor, and whether it's you or someone else that does it, and I'm sure there are others, this hand holding helps. There's a lot of unknowns when you start this journey. And sleep is different. It's different than dentistry. I mean, there's similarities. I mean, we work with acrylic, we work with taking impressions, but it's a whole new ballgame. Definitely a paradigm shift for me. It was when I started. So, again, did the Smart Care 1, and I guess my aha moment was being introduced to the MATRx, because it changed what how I see things and what I do, and
Sure.
made my life in this short term different. But I think, again, it's more than when you start finding a mentor, finding a program that can help you figure things out, provide you the education and the guidelines, kind of hand holding in the beginning until you figure it out and get things going. Again, it's challenging. It's challenging to work with the staff. It's it's medical billing. It's again.
Yeah. What was some of your biggest challenges, if you could? Because I know you're in US. I know our challenges are going to be different here in Winston as well. But what were some of your challenges that perhaps some of them that you might still be having issues with? Because it's important for people to know challenges exist everywhere, right? Even for a guy like you who are doing so much. Yeah.
And they do. I mean, again, the challenges are communication with physicians, getting out there to physicians, and trying to open doors. The challenges inside the office with either front desk staff, hygiene staff, assisting staff, teaching them what to do, how to talk to people, teaching them about sleep apnea and what it's all about. All this is different. And so, in our office, what we did, we hired a group. We hired OSA University and brought them into the office. We took their eight modules, spent almost 8 to 10 weeks of training, so that everybody is on the same page. We all talk the same language. We know what we're doing. But it takes time. I mean, we had simulations in the office where we role played. You have to do all these things to get people comfortable. I mean, again, it's you talk a different language, and patients can be intimidating at times, questioning why all of a sudden sleep, like why are you interested in sleep all of a sudden, like I'm here for my teeth. Why airway? I mean, like they'll at times feel like you're trying to sell them something, or it's totally not it. I mean, we see things and a lot more than what their primary care physicians see, and so we're like right there. But they don't see, they don't get it. They think teeth, and so when you try to introduce something new, it's so again, working with patients, that's a challenge. But again, it takes time. It takes time. I mean, that's.
So would it be fair to say pretty much for you was focusing on the goal, knowing where you wanted to go, not giving up, and then using right mentorship, and then repetition? That's what I'm almost hearing. Role playing, and trying to learn in terms of how to deal with some challenges and bringing the right people and right pieces of the puzzle into your practice. If I was going to
Yes,
summarize it, that's what I'm almost hearing here.
pretty much. Yes, you have to be persistent.
Yeah. How about you, Winston? I know, as I said, like it doesn't apply just to airway. Like you talk
Right.
about some of the other stuff about pain, about how their headaches could be related to their dentistry and their wellness.
Right.
I can see a little sign behind you. It says
Yep.
Wing Wellness Center. And so how do you even bring up that conversation, I guess, with
Yeah.
the patient? I think some of the audience would love to hear that. How do
You
you
know,
get into that conversation?
that's a very good question there as well, Shouresh. So I kind of look at things from like a 10,000 foot view. 10,000 foot view would be the airway, sleeping component, the medical component. But let's kind of bring it right back down to, like Ofer was saying, there's some general dentistry aspects. So, because every day I still do general dentistry as well. So one of the things that I really bring in to connect to the patients, because Ofer's totally right. Like all of a sudden we're talking dentistry and then we're doing this jump into this airway, breathing, sleeping component. How does that connect?
Mm-hmm.
So one of the big things I will introduce first to bridge that gap for my patients is to kind of go, hey, Mrs. Smith, you see how you're wearing down some of your front teeth? That's called bruxism, or you're grinding, clenching your teeth. So I kind of keep it simple with my patients and I'll go, okay, Mrs. Smith, maybe you're clenching and grinding, and this is just generic, just kind of in the situation for her. I'll say, is it because of stress? Well, maybe. Are you clenching and grinding, wearing down your teeth? Is it because of maybe your bite, your occlusion, some TMJ component? Maybe. Sometimes for some patients, it's a medication, it's a hormonal issue. Or the other issue that it could possibly be is it could be airway, breathing, sleeping. So that's the connection that I'll bring down to that ground level to relate the dentistry to the bigger picture of airway, breathing, sleeping. That's my little connection for them. Then they get why I'm kind of going into that portion of the airway, breathing, sleeping. Because again, that's something I look at, as I mentioned earlier, learning from you. The eyes don't see what the mind doesn't know. But now I know to look at that differently with bruxism. I look at the fact that maybe if it is an airway, breathing, sleeping issue, learning from you through the course, there's a 70% correlation with bruxism and obstructive sleep apnea. It's there. There's a connection. Is it the only reason why that person may be clenching, grinding? Maybe, or maybe not. But I need to look at that to really determine, is this part of the, like sometimes I'll say it this way too. Your body, your mouth, it's like a stew. Like maybe it's a little bit of stress. Maybe it's a little bit of a component of occlusion. Maybe it is a little bit of some airway sleeping issue. But I need to look at it in its entirety to kind of help me to connect to the patient. The next obstacle I find too is now educating. And Ofer, you did say that as well. It's how to get that word out. So that's another obstacle that, again, through the training with Shark Education and other various courses too. But to me, to make sure that I'm successful to help with the obstacles, because there's many obstacles along the way, but I need to get the training, I need to have the technology, and I need to be able to talk the talk. So, give the words, give the words, the knowledge base to be able to explain it to my patients well. And again, through you, Sensei, that's things that I learned from you. It gives me then the next level is the confidence. I'm able to deliver what I need to deliver confidently and bridge that gap to connect with the patients. Because again, at the end of the day, I want to make sure I connect and help treat my patients to the best of my ability with the skill sets that I got.
Oh, those, you had a lot of good points in there. So your approach then would be you always kind of go through that whole comprehensive treatment planning, making patients understand, and correct me if I'm wrong, that's what I'm hearing from your conversation,
Correct.
having that bird's eye view and then trying to narrow it down to see what it matters to them almost.
So
And
yeah,
Yeah,
correct.
fitting airway right into that. So you start from the top and then you see where the airway fits almost.
Sometimes I'll look dentally because some people are either they're just in for just basic general dentistry. I'll start from the ground level teeth, but then I've got some patients that come in and I know they've got some definitive issues of airway sleeping issues or medical issues. So then I'll come from the, let's say, the 10,000 foot view. So it's just different perspectives. It's different. I'm finding the right way to connect to the patient to help bridge that gap. So whichever way they come in, I've got some patients, they specifically want to come in because they know or they hear that I deal with a lot of the airway breathing sleeping. They are looking for some other treatment alternatives. Like today, I had a patient, they have CPAP, but they hear, oh, there's other choices. There's some other possible options. So they're in, their perspective is coming in for me to talk to them in that respect. Some other patients, again, it's more ground level with the dental first, then talk about the airway breathing sleeping. At the end of the day, we always we look at it, and there's some patients that may choose to do some stuff, and other patients may not choose to do this.
But it doesn't change our obligation to let them know. Our
Right.
job our job as dentists always is to basically let them know what we see in there. How about you, Ofer? How do you usually bring up the sleep and airway? I think that's one of the questions that I hear from a lot of general dentists here.
I think it's open-ended questions, basically. Let them talk. You know, they need to ask the questions and they need to own the disease, basically. So, you know, I'd ask them, for example, you know, like, I don't ask them, like, do you grind or do you brux? Because it's going to be a yes or no question. Then I'm like backpedaling. It's like, are you aware that you're grinding? And they're like, why do you ask that? It's like, I see signs. Like, what signs? And then they start talking. So you need to, again, get them to realize what's going on there. And by listening to them more than me talking, you get them to say, yes, I do that, and I do that, and yeah, you're right. And then it's like, how do we take care of it? And then, okay, I can help you with that. So for those, that's how I do it. Unless they come from a referred source and then they know they have an issue and it's a total different story. But again, initial patient exam, like, you know, Winston said, it's like, yes, you do a comprehensive exam, and you might point things out, ask open-end questions, let them be part of the conversation, listen to them, and then guide them through this thing. Again, we see things that they don't, like you said, what the eye doesn't see. I mean, they don't see it, they don't know, they're not aware. They go through the day-to-day, they grind, they choke, they have no clue what's going on there. And that's my job, is to educate them and guide them through the process, and they need to own it. Because if they don't, I can't shove it down their throat. They need to own it. That's the only way to do it.
And that's very important. You mentioned it well. It's owning the disease. That's what I like what you said. People need to own their own disease and then look at you as perhaps the person that is going to provide them with the solution to their problem. It's not our problem. And that's what I feel like some dentists kind of perhaps miss the boat. It's about co-diagnosis. And what you mentioned there, Ofer, is in different words, is you put the pieces of the puzzle slowly together for them. And at the end, all of a sudden, they see the big picture. That's how I always look at it. Our job as clinicians are, there's lots of little pieces there that they don't know how it comes together and what is that big picture. Your job, Winston, you're talking about having the big picture, narrowing it down, where what I'm hearing from you, Ofer, is a little bit, hey, I'll put all the little pieces one at a time in there for them. And when the puzzle is all complete, they're like, oh, now it all makes sense to me. And I found the root cause in that sense. So communication is important. What I always talk about is for you have a sleep program that is successful, or any other thing in dentistry to be successful, you need three different skills. You need, of course, clinical skills, but you need organizational skills, and you need communication skills. And communication skills, if you ask me today, it's going to be the most important part of it to begin with. If you can't communicate with your patients properly, that's going to be hard to get the problem across. Then you need an organizational skills, because you need to bring a whole team together, and you both mentioned a team-driven approach. And then the last thing is the clinical skills, which you need to know how to do things. And I feel like, again, for our audience here, it's important to keep that in mind. Always make sure you have those three components. Otherwise, if one of them is missing, we might have some problems in there. But we're kind of about half an hour through the webinar. I do want to get into some clinical pearls here, because people like to learn about clinical things. So I'm going to start with you, actually, Winston. So I'm a dentist. I'm getting into this. How can I make my job easier? What's been some of the challenges? We know we talked about medical billing being part of the problem. We did briefly discuss the titration process. We talked about all that. So what are some of the clinical pearls that you're going to give the audience today? And perhaps you did briefly talk about technology as well. And specifically, I do want to talk about MATRx Plus, of course. How did that fit within your practice? And not the technology, but what was the problem that it resolved for you, in a sense? Let's talk about that.
For sure, you bet. One of the big things that I found that the MATRx helped me once we acquired the technology, before when I do a snore appliance, and I would stumble and fumble, and how do I do this again? What do I do? Had some very basic training. Oh, your best guesstimate is to advance this forward 60 to 70% and let the patients try that for a week or so. And then tell me how you feel, Mrs. Smith. So I really didn't know, and neither did the patient. So it's kind of a bit of a Hail Mary type of scenario where I'm getting how they would do with their appliance, okay? Yeah. Now that I've got the MATRx Plus, it's a whole different ball game now, because now I'm going to relate this almost to like if we're doing a root canal and I've got an apex locator. When I got the apex locator,
that's a good one. That is a good one. Ofer was going to do that one.
The end of that, exactly where the end of that root is. So I can go there confidently. I can go there quickly, efficiently, and I do it well. Same as this MATRx, right? To me, anything that makes it faster, easier, but better. And that's exactly what it is with this MATRx. I dial in, we run the test, we do the baseline, then we do the diagnostic, we do the trays, and it gives me that necessary data that helps me get to the end point efficiently. So my pearl would be, to get to that end game, and knowing that I can do it confidently so well, that's what this MATRx has given me. So even today I had to go through a review of a diagnostic, and right, the machine gives me the necessary data. It told me, number one, was a patient had sleep apnea or not? Check. Number two, are they going to be a responder to OAT, oral appliance therapy? Wow, if they are on the diagnostic test with the MATRx, they are a responder. Awesome, high five, check. And then for that cerebral perfectionist person in me, which I know all of us dentists are you want that precision. The MATRx tells me that magic. I tell the patients it's a magic. There's the magic spot right there. It gives me that definitively, and it gives me with confidence. So I go at that for sure. Let's build this OAT. Let's build this MRD right here. There we go. Quickly, faster, easier, better. And as we kind of talked about before, it's simple, predictable, and it helps me with being profitable because it's so good. So it's like it's a no-brainer now for me. It's technology that I use, and I use it so much, and it helps me every day.
Yeah, and you use a lot. I love that apex locator example. That's a good one. It's like I used to say, if you don't know where you're going, you'll end up someplace else. And the people have heard from Yogi Berra, of course. Yeah. It's like you need to know where you're going, and those are the main two questions, of course, right? Is it going to work for my patient? And if it is, are they going to be able to wear it, and at what location? And that almost allows us to treatment plan properly better. It allows us to kind of actually know what are the likelihood of the patient being able possibly to even tolerate the therapy in that sense. And you mentioned it well, having that, as most of us dentists, we are whether we like to admit it or not, we do have obsessive compulsive disorder. They kind of train us in that sense.
Exactly.
And, somehow when it comes to sleep, we try to do it different way. Not that there is anything, in my opinion, wrong with it. It's just a good way of getting into it. But there is better, faster, and more efficient way of doing it. And it's that's the pursuit of perfection in a sense. You're never going to achieve it, but at least you want to provide that excellent care for the patient. And I know you use a lot of different technologies. You got the scanners, you got the CBCTs, you got all that, and it's a lot coming from you. Ofer, do you want to add anything to that? Because I know you have a different perspective because you did it the old way too.
I did, yes, I did the old way too. And you asked me before,
quote unquote, you said. So let's talk about that.
I mean, so you know, for me, you asked about the aha moment. My aha moment came through, the sleep certification when I took the course with you. When we went over the MATRx, and I'm like, when can I get this? And that's what I did. I mean, the moment we finished the course, the first thing I did is I reached out and got it because it makes so much sense. I mean, I don't know why anybody would like to do sleep medicine without the MATRx, and I'm not exaggerating. I mean,
and I have not paid you, right? Just to make this clear.
No, I wish,
okay.
But no. But I mean, it makes so much sense. I mean, if you think about it, it simplifies and takes the stress out of the equation. I mean, like Winston said, I know exactly when the patient needs to be. They know that it's working because it's, they see the numbers. So it's not like, let's try this or let's try that, be back to titrate. Or, I mean, I tell them up front what's going to happen, and they're like, wow, yes, when can we do this? And then for the staff too, the fact that I don't have to bring the patients over and over for titration and fit them in for, it's just a nightmare. I mean, it's like set it and forget it, like they say. And it makes so much sense. I mean, like you said, Winston, just the patient comes in, consult, diagnostic testing for me. I know exactly where they need to be. We scan, we take a 3D scan like you do. It goes, they back 2 weeks later, the appliance is delivered. And with, milled appliances, I use Prosumnus, and I'm not trying to sell Prosumnus, but I'm sure there are other labs that do milled products. It drops in. I don't have to minimal adjustments. I mean, my chair time is nothing compared to what it was before. And before, like you said, it was stress. I mean, it's like
you're trying to help somebody, but you're losing a few years off your own age.
Yes, it's a crapshoot. It's like, it's between 25 to 65%. Let's try this and hope it works. And come back in a couple weeks, and how do you feel? And that's the thing. The other thing is, like, it helps you with your communication with physicians, because I'm more confident going out there and saying, patient is at a therapeutic level. I know it's working. So when I send them back to the physician, before I was dreading that. I would write a letter, say, patient, no nocturia, if doing fine, they're dreaming. You send the patient over there and they come back, it's either worse or the same. And I'm like, what did I do wrong? And I'm like, okay, come back, let's titrate more. And now they have issues with their joint because you're pushing them. You play with adding I mean, it's like, it was a disaster. But now I don't have to worry about this thing. I mean, they come and it's a done deal. And I write the letters, I put the final test that I do after I deliver a month out with the results in the letter. The physician can see that. If they want, they can share the results on the portal. I mean, it's streamlined. It simplifies my life, simplifies patient's life. It simplifies the physician's life, because they know that it's not back and forth all the time. A patient is being treated. So
that's key. That's key, right? That's what you mentioned, of course, is the whole notion of patient coming back and they're not treated. Not only the patient is almost frustrated, and the physician may lose trust and confidence.
Correct.
It makes us as a dentist question our protocols.
Mhm.
And the thing that a lot of us forget is our team. Our team does not bring that up all the time, but in the back of their mind are thinking, well, is this a good service that we're providing? Although Winston and Ofer are telling us, yeah, let's go ahead, but is it really helping our patients or not?
Mhm.
And that's how you lose. In a way, what I'm hearing is you're basically utilizing it for your communication skills, which we talked about earlier,
Mhm.
to communicate better with the patient and with the team, to use it for your organizational skills almost, to bring your team on board and getting a good team. And of course, for your clinical side, it's simplifying your chair time, your
Mhm.
techniques and everything.
Yeah.
And
You
Man,
bet.
that's very interesting.
it's funny. It's like, I don't celebrate Christmas, but
Yeah.
it's like after a patient does the test, the following morning, it's like open a gift on a Christmas morning. It's like we all go to the portal and see like how did they do? How did they do? And everybody's like around like, are they a responder? Are they a responder? I'm like, okay, let's figure it out. So it's like everybody's getting excited around this thing, and that's just
Yeah, and we love that. Actually, we use that a lot in our clinic as well. Having that on the portal, so before the patient even comes in, we do know if we need to set aside, on a serious note, 15 minutes, or is it going to be a 45 minutes appointment? And if it is, because if they respond there, we're ready to go ahead and take records the same day, so we don't have to bring them back. And that's the beauty of technology and having cloud-based connectivity in that sense, right? Winston, do you want to add anything to that one? We're already at 10 to 6. I don't know how the time flies.
Where does time fly?
I'm getting a little nudge from our team at Zephyr telling us I have only 10 minutes.
No, whatever. I'm just here to help and answer, carry the torch, whatever. I mean, you're on a time limit, so whatever
no,
you.
I do want to ask this, though. I do want to ask one thing from each of you. I'm going to bring it down to one. If you were going to tell one advice for a person who is getting into sleep, or who, actually, you know what? I'm going to get 3 advice from each of you, but make it short. 1, somebody who's not getting into sleep yet. 2, somebody who's doing sleep but not as efficient. And 3, somebody who is doing sleep but perhaps not utilizing technology yet. What would be your advice, or whatever you want to tell them? I'll start with Ofer.
I mean, for someone who doesn't do sleep, you owe it to your patients.
Yeah.
You owe it to your patients. I mean, you're there, you see them. I mean, you're obligated almost to do that. Not doing it is, I don't know. You want to call yourself a doctor, you have to do that. So find someone, or again, a mentor of some sort. Take courses, get educated. I think education is key to whatever you do, and then everything goes from there. For someone, who's doing it, again, like we said, as far as adding technology, I think using the MATRx is a no-brainer. Like Winston said, it's like doing endo without Root ZX. If my battery's out on the Root ZX, I freak out. I mean, I need to have it there because I'm not gonna go in there and take 5 extra to find working length. I need to see what's going on there. And that's what the MATRx does for me. So, that'll be my recommendation for those people. It's like, use technology, use the MATRx, and educate yourself.
For sure.
Winston, you want to add to that?
Yeah, you bet. Same ditto. What Ofer's saying for sure. I'm going to kind of relate it to this, where it's like anything that I've gone out and learned, any of the skill set. To me, I always feel like I got to learn from the best of the best. And again, I'm not blowing smoke here, Dr. Charkhandeh stress, but to me, I felt like once I learned from, as what Ofer was saying, a mentor, someone that I can kind of bounce things off of, mentor, sensei, Shouresh, for sure, that's awesome course that I've taken with you. But going to this, you need to get into this journey of dental sleep medicine. You need training, you need knowledge, you need the technology, you need to train the team. So all those things you'll hear about for sure, and I've learned this in spades from your course. But the thing that I really gleaned the most from is like, well, how do I say this? What am I looking for? I got it from the course. I got it from the MATRx Plus. I learned all this stuff. I take this information that I've learned, because once I get this information, data, it's like, once I get this, if you learn it and you can say it and deliver it confidently to the patients, then isn't that worth its time and its weight in gold for me to kind of deliver everything that I need to deliver? So I really found that, again, training with Shouresh, using the technology with the MATRx, that was a great package. I got that, I learned it, I do this stuff every day, easy, done, fantastic. It's a fantastic way to do my day-to-day dentistry, to again take care of my patients each and every day.
That's thank you. Those are you're very kind as always, and but I love how both of you keep on going back to the patients. You owe it to the patient. That's what you said, Ofer. And you said you take care of your patients. At the end of the day, it comes down to good patient care. Everything that we do is to provide the best care for the patients and to do it in an efficient and hopefully profitable manner, because you need that profits to be able to do what you want to do. But I like to be the devil's advocate for one more minute. Technology costs money, technology costs time, technology costs education, technology costs me being away, and technology costs confusion with the team. Why would I want to do that? Why can I do it a simple way, Ofer? Why not? You know, why should I spend? And this thing is hard. Getting a CBCT, getting into it, getting a MATRx Plus. I need to learn how to put the trays in. I'm doing it and it's working. Why do I need to do it differently?
I mean, again, for me, it just made my life easy, and it's all about, you know, for me, you know, reducing stress level. And if I can go through the day and know exactly where I'm at, no surprises, it makes my life easier. My team is relying on that because they feed off of me. If I'm upset, you can see it in them. We are together in this thing. So if I can reduce my stress level and have a nice, easygoing day, it's worth it. You know, again, it cost in a scheme of things, it's nothing. You know, it's money. Money comes and money goes. It's at the end of the day, the quality of, you know, they talk about access to care. I'm talking about access to excellent care. And that's what the MATRx is doing for me. That's what it's doing for my patients. So, you know, yeah, it's, I don't see that. I don't see it. I don't see it as a hindrance. You know, cost is a hindrance. As far as learning, you know, I learn something new every day. And if I don't learn something every day, it's a waste of a day. And I try to learn something from my patients, from what I do. Every day is something new. And so, again, introducing technology, it's the way of the future. And again, that's where things go. I mean, you can't, if you stay stagnant, good for you, but you know, this is not how I see myself. It's just, you have to move forward. And, you know, again, for me, it's worth every penny. Yeah.
How about you, Winston? I know you make a lot of money in a small town called Peace River because people have teeth and gums there too. But
That's right.
you know, not everybody has that money. Why do I need to spend money?
So, you know, for me, the same will apply for, again, talking about this in the overall discussion. It's faster, easier, and better when I have this technology. When I have data, it's a fact. So again, without the MATRx, it wastes a lot of my time. So again, efficiency is key now when I really try to really boil it down. You mentioned earlier, it's an organizational component. So if I can cut to the chase, find out from the data if this will help this patient, it makes it all a lot easier, a lot better, especially for treatment care. And I can then deliver this care. Big word for me is confidently. I'm not hesitant anymore like I was before. I can just say, boom, this is going to be awesome for you, Mrs. Smith. Why? Because I've got this data, and that makes the world a lot easier for everybody.
Yeah, just providing the best. Like, that's awesome. Well, as I said, I can go on. I can have so many questions in my head right now, getting into technical aspect of things, but It is almost 6. I do want to get to the questions. We're allowed to have some more time to get to the questions. But before I get to that point, I do want to thank you both, honestly. I just knew I was gonna get a lot of good pearls out of this. I've taken a few notes myself here. Always learning. Great to have you both on here with us. And for the people that are online with us, you guys are lucky to have these two great dentists and clinicians with us and share their experience. But I do want to summarize everything because I like kind of putting everything into perspective in a nice little package and give it back to the audience. What I've heard from both of you, and please add if I missed anything, is number one, if you want to do good dentistry, never mind even comprehensive dentistry, if you want to do good dentistry, we need to learn about airway and sleep and the impact of it on dentistry. If you want to do comprehensive dentistry, you must learn about airway and you need to be aware of how to discuss it with your patients. That's number one. Number two, if you choose to actually provide the treatment for patients, make sure you start it in the right way, get the right mentorship, and get the right technology into your office, and get your team on board. Work on the communication skills in that sense.
Absolutely.
And last but not least, don't let cost get in the way of your providing what gives you the sense or the pretty much almost what your meaning of practicing dentistry for me is. It's providing the best and doing the best. And well, you started from that. You said, I became a dentist to provide the best care for my patients, and it doesn't matter where I am, and that makes me feel good about my career, and it makes my career more rewarding. And I feel like Sleep and Airway almost fits that perfectly. It allows us to be part of medicine, add many years to our patient's life, and actually have a fulfilling career. It's not just about our patients. It's in a sense about our own professional life, the same way as it is for our patient's life. That's, I would say, perhaps the summary of today. If you guys want to add anything before I go to the questions here.
Oh,
and don't do it blindly. Actually, don't do it blindly. The root ZX, I think the quote, I don't want to give a award to either of you, but I think the quote of the day was root tip locator, and then we branded it by root ZX here, so we're good.
Yep.
That's great. All right, I'm gonna open it up. I'm gonna bring Oren back on the line with us. Oren, can you hear us here?
Yes, I can hear you guys. Thank you for a wonderful talk. Thank you.
No, thank you for being here with us, of course. And I believe there's a couple of questions. I'll let you jump in with us and fill us in.
Awesome. So first question. So this one is about bruxism and medications. It's known that some medications may induce bruxism. Is it possible that some may also influence obstructive sleep apnea?
Okay. Who wants to take? Ofer, I'll go to you first. And then.
I'm not sure about that. I'll be honest with you. I'm not aware. I'll be honest with you.
I can jump in on that one. Vincent, do you want to add a few things to that? Or
yeah, you jump in.
Yeah, so I'm not sure exactly what the question they're asking, whether or not medication could impact their sleep apnea. The answer is, of course, yes. Right? There is a lot of medication out there that could impact your breathing at nighttime, right? Whether it's benzos, whether it's actually, there's a lot of medication that cause bruxism that could cause the sleep problems as well. Of course, if you look at the anti-anxiety, antidepressant medications such as SSRIs, we know there is a lot of correlation there between even lack of REM bruxism and sleep issues and all that. So if the question is whether or not there are medication that could induce sleep apnea, the answer is 100% yes. There is a lot, anything that will affect your airway and your response to respiratory stress throughout the nighttime can perhaps make your sleep apnea worse, or perhaps even cause sleep apnea, whether it's obstructive or central. Are there medication that could cause both bruxism and sleep apnea? The answer to that is yes as well. So taking a proper, good medical history, going back to a comprehensive examination, is of essential and utmost importance when it comes to OSA. You almost got to think outside the dental box. You got to think about medical box, and again, the bird eye view down to narrow it down. So, and again, with big correlation between OSA and psychiatric and psychological problems, it becomes even more and more important to keep both of them in mind. I hope that answered the question. If they want to jump in, and if anything, just put us in the chat box.
Wonderful, thank you all. Next question, what are the contraindications for TMD patients? So I think this would be more in general for the actual appliance itself, but maybe also for the entire process.
Yeah, I'm gonna refer this one to both Ofer and Winston. I'm gonna start with Winston because I know you did a lot of TMD, a lot of pain management patient, a lot of occlusal rehabs. I'm curious to see how you'll answer it. And I know Ofer, your background is in TMD, so I want to know where you kind of fitted this with the pain management and everything else.
Right. Okay. So for me now with OSA and TMD, I definitely look at both. For sure, when I look at this, for example, when I look at TMD, bruxism, I know there's a high correlation, 70 to 80% of patients with the bruxism may have OSA. So when I really analyze and organize, I go, is this a patient a TMD patient? Or is this patient more airway sleep issue? And sometimes I feel like there's patients that are a combination. So I kind of got to filter through and really ask. So what I tend to really do is I have a lot of screening questionnaires that I go through to really find out where do they sit? What's their primary concerns? And I really listen, as what Ofer was saying, we got to stop and listen to really find out, are they having the TMD issue? Or am I hearing that they're more fatigued? Or they're having more issues with in that respect? And then from there, I back up and I look, okay, maybe we better find out, do they have some issues with airway, breathing, sleeping? Then I enter my MATRx Plus because I need data. So when I really look at the data, I can kind of determine, is this contributory to their TMD? At that point, when I can figure out, are they TMD and or the airway sleep issue, that then helps me figure out a few more details, which avenue I may go for treatment. Of course, you need to look at the cone beam. You need to kind of decipher if there's any other issues there, a comprehensive dental exam as well. But so I kind of gotta, each case is kind of different, but I kind of figure out which tool do I need to use to help with the patient, depending on what is their primary concern and what I see. Did that kind of help answer some questions? I kind of went around that.
Yeah, no,
right.
That's great. Ofer, do you want to add to that?
I mean, I do the same thing. Is, you know, you definitely go through the comprehensive exam, take a look and see what's going on there, what the issues are, and trying to discern what the problem is. But that's where the matrix come into place, because, you know, it allows me to, again, titrate or get them to a position where I don't have to stretch them too much and exacerbate conditions that are there. You know, you basically splint their joint basically. So from the get-go, it's stabilizing things. So most of my patients who come with DMD, having gone through the matrix, are doing better joint-wise. That's what I find. Again, because again, what the machine does basically kind of brings you back to the spot where you need to be without stretching you too far, and not exacerbating conditions that are there. And again, going through your dental exam and going through different modalities, whether it's questionnaires that you go through as part of their medical history, I think the bottom line for me, what made a difference is the matrix, and again, solving things for them.
I want to add a couple of, well, you guys basically covered it perfectly, but I do want to add a couple of things just in case the question was a little bit more direct. There are a lot of, I like to call it a myth or whatever we want to call it, misnomer. I don't want to label what it is, that oral appliance therapy is a contraindication for TMD patients. That was the initial thought early on. We're talking almost 2 decades ago. Today, we actually know the oral appliance therapy in the right patient, in the right individual, can actually help heal and manage some of their TMD issues. And exactly what you mentioned, Winston, doing that proper data gathering at the initial appointment, and doing that proper treatment planning later on, utilizing all the data that we gathered through our exam, through our MATRx, through our imaging, through our intraoral scan. That's exactly what we talk about at a Smart Care all the time. Gather all the data like everything else that we do in dentistry, then sit down with that objective data and treatment plan. And in a nutshell, I can tell you, especially when you look at the correlation between TMD and sleep apnea, you cannot manage the TMD if you're not managing your sleep apnea. So is it a contraindication? No, unless the patient have, of course, extremely severe degenerative joint disease, that they're having a lot of internal derangement problems. Even in those cases, knowing where you're going and knowing whether or not you're going to improve their airway. Remember, if they're breathing better, they're sleeping better, their healing is going to be better, which means that your TMD therapy outcomes are going to be better as well. Most patients that come to me for TMD assessment right now end up in a sleep device because I rather get them breathing first and see if the body can heal itself better. So a simple answer is no, do not use TMD as a contraindication. A patient with TMD issues are not simple cases to begin with. And we talk about case selection, simple, intermediate, and advanced cases. And it comes down to treatment planning and data gathering, like everything else that we do in dentistry. Yeah.
Right.
Great. You know, if we could get a little bit more specific on this, one of the attendees is asking, what about a patient with pop and click in the condyle? How does that affect specifically what you're doing when dealing with this?
Okay, I'll jump into that myself because I love this topic, and I feel like one of the things that we missed for I feel like this was maybe a set question. I don't know. I didn't ask it, but pop and click, of course, has many different levels, right? We all know. You know, is it a anterior disc displacement with reduction? Is it anterior displacement without reduction? Is there deviation? Is it like I'm not going to give you a whole TMD lecture here, but key here is anytime you get an internal derangement, which is technically the pop and click, that means that the meniscus, the little cartilage, is not sitting right on top of the condyle where it needs to be sitting. If you're taking your bite registration, if you're doing your bite registration, having no respect for that, and you're not paying attention to that and spending the time to capture that disc and place it right on top of the condyle, it is going to create a lot of problems, both in terms of bruxism, appliance breakage. This is just my clinical findings, to be honest, and even pain in the joint, because you can be stretching the actual ligaments through with the appliance. The patient may want to be going towards the side that you did not capture. There's a lot of reason that we think about the lateral fin breakage that we talk about. So it does impact your bite registration. So again, I do not consider those simple cases. We always talk about you must capture the disc once you're doing the bite registration for oral appliance therapy.
Right.
If you capture the disc, in a matter of fact, you can actually help a lot of these patients remove that stress from that disc throughout the 8 hours a night that they're wearing the appliance, and perhaps prevent it from getting worse. In your lucky cases, maybe you actually promote some healing as well. So going back to that, those cases are actually, I enjoy working with those cases because you're going to accomplish so much more than just their airway. A lot of them can come back and tell you they're actually joint and their muscles are feeling better, but you need to know what you're doing. Capture the disc when you're doing your bite registration, because if you don't, that's going to be most of the problems that you're going to be dealing with. In dentistry, a lot of side effects, problems, and issues that we deal with is not because of therapy. It's because we didn't spend enough time, in my opinion, gathering the data and identifying those risk factors early on. If you don't identify it, it comes back, now you're in trouble. So don't be afraid of those cases.
Great. So this next question coming up is about the Matrix Plus use. Do older patients have difficulty using the Matrix Plus?
No, I mean, I have patients in their 80s that I was concerned initially, but they surprised me. I mean, they did actually better than the younger patients at times. I mean, go figure. But no, not a part. And the beauty of this thing is like the system come with the you know, with a tablet. There's videos, the instructions that you know, you don't have, you have to be a rocket scientist to figure it out. It's so simple. You almost, I want to say, you can give it to them and they'll figure it out by themselves. I mean, I spent time showing them what to do, but it's simple enough. So even older patients can easily do that.
What's been your experience, Winston? I know you've had yours for a while as well.
Yep, same idea as well. We always seem to have some patients that maybe the difficulty if they're a face sleeper, those kind of people where if we're getting to diagnostic, they may have a little bit of difficulty with some of the gear, but most people will tend to adapt, and as long as the machine gives me that necessary data over that period of time, that the matrix does work very well. It's very efficient. So, but yeah, most people adapt quite nice.
Yeah, and, I have to kind of agree. I always say, like any technology that we use, there is going to be times that we are limited. There is going to be times that is going to be challenging. And in my practice, I would agree with Ofer and Winston. It's rare for us to have that problem, but I've done many more in the past many years. We had perhaps a handful of cases that the patient, it was not necessarily age, but just the patient not being able to tolerate it. This is not to say that technology have its own limitation. Every technology does. But I would say over 98 to 99% of patients will probably tolerate it really well if the trays are fitted properly and the proper instruction, not instruction. We actually try to set the expectations low for the patients. Well, it's going to be moving your jaw and all that. You got to have the right communication with the patient and utilize it properly in that sense.
Yeah, it's like you have to coach them. I mean, if you coach them right, they'll do it like anything else.
Yeah, correct.
Wonderful. All right, so this is going to be our last question here. How accurate is the Matrix Plus? So I know maybe Shouresh, if you want to
answer that one, I can take a stab on that one. I'll go based on, I'm not going to talk about our clinic data because that's more of anecdotal. I try to be right to the evidence when I answer these questions. Based on our clinical trials that we've done, and we've done quite a few by now, including our initial Matrix and now Matrix Plus, which is the at-home. We have a lot of data on that one. In terms of prediction of outcome, and that means that predicting whether or not a patient is going to respond to oral appliance therapy or not, defined by reducing their oxygen desaturation index to below 10 and 50%. So very, very defined clinical criteria as we're talking about here. The accuracy is upwards of 98%, if not higher at this point, I believe, depending on how we're looking at it. Then there is the second component which talks about basically predicting the target protrusive, that efficacious target protrusion where you can set the mandible, and that usually lies around that 86, 87%, if I'm not mistaken. And that kind of would be consistent with what I'm finding clinically as well. What's very important to remember, though, is that is in all comers. That means that we are not excluding patients with severe sleep apnea. We are not excluding patients for any other reason, unless their BMI is over 40, morbidly obese, or if they have some really serious dental problems. So we're looking at all patients here. And in our clinical trials, we've predicted between 60 to 70% of patients to be responder to oral appliance therapy, which is very, very important because today, out of 100 diagnosed patients, this is like a clinical practice tip for you. You can spend many hours, and this is where we use it a lot in our clinic, many hours, and diagnose 100 patients with a sleep apnea. Based on conventional workflows that we all used in the past, we would get 8 or 10 of those patients back for oral appliance therapy. That's what the data is. 90% of patients get CPAP, 10% get oral appliances. But when we use Matrix all in the initial stage, as soon as they get diagnosis, we're going to give them the option. Do you want to do CPAP or oral appliance? And we use it as a predictor. Now we're getting 60, 65 patients that are going to be candidates for oral appliances. Right away, you're multiplying the number of the patients that you're going to be providing care for. And that alone is a big game changer for us, which almost forces you, if I'm going to see 60 patients as opposed to 5 patients, that's 10 times fold more patients. I better be efficient, otherwise I don't have chair time. I cannot. Your challenges become different. Your challenges is not whether or not they're responding or not, because you know that. Your challenges is not how many times I need to bring. Your challenge is how am I going to accommodate 60 patients in my clinic? And I don't know what Winston and Ofer has to add to that. For me, that's very, very important. That was a game changer for the business.
Yeah, that's true.
Sure. Yep.
Yeah.
Wonderful. Thank you all. That was excellent. I really appreciate it. Those are all the questions that we have for today.
Well, thank you so much, Oren. I want to thank, of course, Ofer and Winston first one more time. Dr. Doron, Dr. Wing, thank you one more time for joining us.
Hey, thank you. Appreciate it.
Pleasure and honor knowing you both. I love calling you both friends, and I'll look forward to seeing you both, hopefully in person in the near future when all the challenging times are, of course, over.
Yeah.
I don't know if we will be sharing their contact info or not. I'll leave that with Oren and our team. If there is any questions for Dr. Wing or Dr. Doron, please contact our team and we'll make sure we'll pass on that information. If there's any questions that did not get answered tonight, make sure you let us know. We'll answer those ones. A couple of small announcements as well from the Zephyr team. There is a special promotion going on for the MATRx at this point. Ofer may not be happy, Winston may not be happy, but this is a limited time here.
I might be going for a second one, so.
Oh, there we go. There we go. That makes it easy right now. So there is a $2,500 rebate on anybody that purchases a Zephyr Matrix Plus unit from now until the end of the year, December 31st, which with all honesty, it's perhaps the best pricing we've ever had in the history of the company at this point. Also, for people that are using the Matrix Plus already, Zephyr introduced a program which they will replace all your disposable for every Matrix testing that you're doing from now until December 31st at no cost. So if you are doing, there is a form that you can fill out, and they will be more than happy to replace those disposable for you as well. If you're interested in more education, of course, we'll be more than happy to help you with that, with the Smart Care protocol. That's through Chark Education. And if there's any inquiries, either through myself or Zephyr team, we'll be more than happy to help you with that as well. But most importantly, start screening your patients. And if there is anything any of us here we can do in this team to help you, great mentors. We talked about mentorship. Reach out to Winston, reach out to Ofer. I'm putting them on the spot here, but they are great mentors that they can help you in your journey. And,
you bet.
Thank you all for spending the last hour and 20 minutes with us. And a pleasure spending it's a Thursday evening, I believe. I kind of losing time tracks these days with a little baby at home. But thank you all. Have a great evening, and look forward to seeing you all again. Thank you, Oren, as well.
Sounds good. Thank you.
Thanks,
Have a great night.
Shouresh, thanks. See you later, Ofer.
Yeah.
Have a good night. Take care, Winston.
Care.
Take care,
Bye,
Oren.
guys.
Bye.